Assalamu alaikum. Okay, so today was my first shift out of 3 for the week. I've gotten to a phase in my orientation where we can now take more critically ill patients, which is very exciting. So I have been able to take a 3-patient assignment, and I just want to briefly explain what that looks like. So I go in, I get report on my first baby, I do my safety check, and then I go ahead and I continue to get report, do my safety checks on the rest of the babies that I have. It's very important to do your safety checks, make sure that the weight, like the dosing weight is correct, just making sure that all the numbers and all the orders match. Briefly look at your orders and the MAR if they have the chart pulled open. It's a very helpful tip. Once I get report, I start my first care. Cares consist of doing an assessment, whether that be a full head to toe or a focused assessment. After I do my assessment, I change the baby's diaper, and then we get on to feeds. I've been able to administer medications through G-tube and G-tube. We've been able to do feeds with NGs, G-tube, or bottle feed as well. So I've been able to, get those skills that I've done for adults, but just smaller. Once I do my cares, sometimes during cares, rounds will happen because I'm doing orientation on day shift. So the nurse practitioner, a neonatologist, maybe case management, or maybe even like social worker, like breastfeeding, like educators will come around and try to talk to parents. I think the biggest difference between working with adults and switching to pediatrics, or in my case NICU, is definitely education, because I do not provide patient education, I provide family education. And with adults, family education consisted of updates. What happened during my shift, what happened during the previous shift, and what's the overall plan of care? What's the goal? How are we going to get this patient out of the hospital or out of ICU? With my babies, it's more like, well, how am I educating my families? I've had parents, adopted parents, I've had moms and dads, and then I've had siblings. I've been able to educate on like feeds, the overall plan of care, medication administration, what kind of medication I'm about to administer. And I think having prior experience with patients, providing education to family, I think that I have a lot going for me in that department. But going into a completely new specialty, I have completely tried to unlearn everything. I'm not in residency as I was in my new grad stage at my old hospital. I did residency my first year as a new grad nurse in my previous hospital prior to going to ICU. I also took, they were called ECHO modules, ECHO classes, because I was going from a new grad nurse to straight into critical care. This time around, I'm only doing orientation for about 12 weeks. I am taking some classes. They call it like a boot camp, where we are power throughing all the systems of a newborn, and then learning of course about disorders, or disorders, pretty much disorders. But it's like a crash course for me. We briefly went over the neonatal, like maternal newborn in nursing school. So this is a great refresher, but because I fell in love with the specialty so much, a lot of it is review, and I retained a lot of information because I was so interested in the specialty. So going back to educating families and the main difference between working with adults and working with babies, I definitely feel like it's providing that family education that I really didn't have to do so much when I was working with adults. A lot of my patients either didn't need to didn't need to get educated on what I was doing because sometimes they were intubated. I would still talk to my patients, but it's nothing like this. I still introduce myself to the baby or try to talk to the baby as much as I can, soothe the baby, but it's more so talking to the families and educating them. I'm learning myself, so I'm very open. I think that the relationship that I'm trying to build with my families it's coming from a place where I have confidence because I've been a previous nurse, and I'm not afraid to say, I came from adults. I'm not a new nurse, but this is all still new to me. And I also like to provide that sense of autonomy, not to the patient, but to the families as well. So I do offer, before I do anything, would you like to administer this medication? Would you like to change the diaper? Would you like to feed the baby? Or would you like me to do it? Just, get out of the way, give you guys a break. So I just wanted to briefly go over the things that really stuck out to me the past couple weeks. Like I said, this is my first shift of 3 in a row. I was under the impression that we were probably going to get like maybe the same assignment, but given the outline or guidance that my educator has provided me with on what phase I should be on, depending on what week I'm in the orientation, I think we've decided that I'm probably ready for more critical patients. So inshallah tomorrow I will be able to see lines, more access. So we do have umbilical cord access, of course peripheral IVs, PICCs and stuff like that, and then respiratory support as well. So your cannulas and then some other machines that I've never even heard of because I'm not working with adults. Assalamu alaikum. Today was the second of my 3 in a row. And we did get higher acuity patients. We were on the sicker side of the NICU. There were 2 patients that we were assigned. I want to say they were different. One was more respiratory, the other one was more GI. So I got to see and spend more time with the history of the baby and try to understand the plan of care more, which was amazing. Originally when I got report, I was kind of discouraged because there was a lot going on in the history with what happened during birth and immediately following birth with the babies. So I was very intimidated with how much was going on in such a small amount of time. While I was receiving report, I felt that I couldn't really keep up with all the acronyms, with the special cares that we were doing for the babies. They were individualized for each patient, which of course there's orders to follow, but a lot of the skills that we were performing today was new, especially because I'm going from adults to NICU. More so in like the skills of like wound care, ostomy care, I was able to practice those skills. I got to suction a baby for the first time, which I'm used to long yankers. I'm used to handing an adult a suction device versus this teeny tiny suction device and this teeny tiny suction canister. Just super cute. Super cute. As always, we like to make sure that our patients are progressing towards our goals. I've been getting better with charting. It's been efficient. It's been accurate, and charting on like my end of shift report note has been getting more faster. And then I also gave report on both of the babies to 2 different nurses. It was not updates, it was a full report. If you're new to nursing or if you're not familiar, when I came into the beginning of the shift, I received report on who this baby is, what we're doing for them, what happened to them, and how can we get them better to go home. And then because the nurse that gave me a report at the beginning of the shift was not coming back to relieve me at the end of my shift, I had to give an entirely new report to this person that was obtaining care for the patient. So I had to go over the history of the baby, what was going on with the baby, what's our plan of care, and what are the skills that are we doing during our shift to take care of the baby and their special needs. Yes. It's very overwhelming. It's a lot, but I have an amazing preceptor and I'm so grateful for her. She makes me feel like it's not a preceptorship. She doesn't make me feel bad for asking questions or when I make a mistake. It's like, oh, by the way, we do it this way, or this is why we're doing it this way. I feel like she gives great responses when I ask questions. She encourages questions, and she's just very great at giving advice and tips and tricks. So yes, it was a great day, and tomorrow we're supposed to have the same assignment, inshallah. So tomorrow we'll be focusing on me getting a report, going to a flow of my cares, my assessments, and hopefully I'll be able to do more hands-on on my own. She was just a second set of hands. Usually if you have like a squirmy baby, we had older babies today, so they are more wiggly, they're more alert, they're more upset. So it's very important to use your resources when you're in NICU. You're supposed to grab another nurse if you're going to do something a little bit invasive. That way we can hold down the baby, make sure that they're safe, make sure that they're comfortable, and we're able to console them. So she was kind of like the second hand, and then I was, of course, like doing all of the skills and the assessment. So tomorrow, again, just trying to make sure that I can be a little bit more independent, and then a little bit more efficient on receiving a report, maybe asking more questions when I'm receiving a report. So okay, so today was 3 of 3, and I feel pretty good. I'm exhausted. I feel like my body has gotten used to day shift, and I'm kind of sad that I will be switching to night shift after next week. I do want to say, okay, so today we did have the same assignment as yesterday. We had the same 2 patients. I was able to get a better understanding of what the overall plan of care was for the patients. I was able to talk to the surgical team and the critical care team. Even though they were doing rounds, you do rounds, you give a general update on how they were doing or how they did that previous night or that previous shift. But I feel like once they do like maybe a second pass, it's kind of like, hold on, why is this baby still here? What can we do today, this shift, in order to progress? I wanted to show, because today was kind of more like a repeat of yesterday's shift, I feel like I didn't really I can't remember right now. I'm drawing a blank if I actually learned anything. I did talk to a neonatologist a little bit more than in the previous shifts, which was nice. And this one was actually more educational than the other ones. This neonatologist took time to educate on his rationale to what his specific goal was for the patient, which was very nice. I've had a great experience so far with the providers in this hospital. It's a complete 360 from my last experience. So yes, doctors and nurse practitioners sometimes can be, not so much nurse practitioners, more so doctors can be, it can be nerve-wracking to talk to them, but you just have to know what you're talking about and ask a lot of questions, and then you'll be fine. I wanted to go over what we were provided with specifically in nursing orientation. I was provided with my unit folder. This folder goes over like a NICU resident orientation checklist. So this checklist is pretty similar looking to what I received in my previous orientation on the vascular ICU at my previous hospital where I was working with adults. It goes over basic skills that you should know before you are practicing independently on your own. Personally, I have not gone through any of this paperwork because it's just information overload. I mean, you're taking classes, you're attending lectures, you're completing modules. It's a lot of information. It's just like information overload. So because I was already in an orientation prior to this, I already know what to like skip through, what to like tune out, and what to prioritize on. And of course, that was just how to be a NICU nurse. What is the difference between being an adult nurse and switching to NICU? So I feel like that was just my priority. I only get 12 weeks of orientation versus the other resident new grad nurses. They get 16 weeks. So I will be on my own much more sooner than the other nurses. Like, what do I need in order to safely practice and take care of a 3-4 baby assignment coming off orientation. So going back to this folder, it has my checklist. This checklist consists of dates and initials of these skills that I performed. Basic skills like, of course, in the front page is like a scavenger hunt, so you know where the code cards are, the exits are, the fire extinguishers, all that kind of stuff. And then it'll go on to like, for example, G-tube. Can she flush a G-tube? Can she administer medication? Just like basic skills. This first tab, it says general NICU info, so I'm assuming this is all like unit-based information. Yes, so it goes over contacts, very important. This is very nice. So my previous unit was a smaller unit, so we have a map of the unit, which is very helpful because it's a very large unit. Our NICU is divided into south and north, like my previous hospital was divided, but it's around 90 beds, so there's a lot of patients. How to log into your portal if you want a locker, how to log into just basic websites, and then it goes over Neo Rapid Response. I can show you this page because it's not like unit specific, but how to activate a code, PALS code. PALS are for pediatrics, so we do have babies that are old enough that don't meet the neonatal resuscitation requirements. They would be pediatric resuscitation. So more escalation code protocols, scheduling. The next tab we have is scheduling time off in Chronos, and then the last is orientation paperwork. So this is your pretty basic, like, welcome to our unit folder, which, again, I haven't even looked at it, if I'm being quite honest. This other folder that I received, I think I got it on like the first week of orientation, which was more so information about the hospital. So the first day it was over Zoom. We spoke about the history and their motto and all that stuff. It was like 8 hours long. They went over benefits and how to access that and who to speak to. And then the next couple days of the first week of orientation was, we did skills, basic skills. So typically they want you to complete how to do like an AccuCheck or check a blood sugar with a glucometer, the machine that you check a blood sugar with. You have to actually badge in to use the device, so they like to get that out of the way on orientation instead of waiting until you're on the floor. Another thing that we have been doing each week of orientation is a boot camp, which is my favorite part of orientation. So boot camp is similar to my echo modules when I was in the previous orientation. When I completed my echo modules, it was only for new grad nurses. Backtrack. It was for nurses who have no previous intensive care experience. So my echo modules are similar to this NICU boot camp. I have never been in NICU, so I have no experience with babies or children. So this boot camp is divided into systems of disorders. We'll just say disorders. I feel like there's another way of disorders, but it's fine. So, for example, neonatal skin and skin care, how to take care of a baby if they have wounds, what diaper creams we use, that's very important, what tapes we have, that's very important because tape can be very abrasive on a baby's skin. Neonatal abstinence syndrome, we actually have an entire hallway designated to neonatal abstinence babies. It's very important that you know how to take care of these babies because they have higher needs. We did skills labs for neonatal abstinence syndrome scoring. So you actually have to assess this baby and the level of withdrawing that they are experiencing in order to treat them appropriately so that we can keep them comfortable. Okay, so the systems that I was referring to is because neonates are so specific into what disorders that they can have, it is divided into each system just like nursing school for an adult. So boot camp day 2, we went over the gastrointestinal system. Followed by a lecture, we did a skill. So we accessed G-tubes, Rapogals, and enteral tubes and ostomies, which is wonderful because I've been taking care of an ostomy for the past couple days. Yes, we went over the cardiovascular system and cardiac defects in newborns. We also went over the discharge process, which I have discharged a newborn. Unfortunately, because I'm going to be on night shift, I won't be doing as much discharging. So in the event that I am switched to day shift and I do have to discharge a baby, I'm going to have to like run it over with somebody else. But they do have like this laminated packet in the charge nurse station where it goes over the steps to make sure that you complete education and you're charting appropriately before you send the baby and their family on their way. Another thing we talked about on boot camp day 3 was the transport team, and we did an ICU tour. So the transport team, they have a helicopter and they have I think 3 ambulances, but one of them is not working at the moment. So anyways, so we got to talk to the transport team. We also got a tour of the transport floor and we got to see the helicopter, which was very nice. I'm not a picture girly. I wanted more information. I was asking questions and I wanted to genuinely show them that I was interested versus just taking a picture. So there are no pictures of the beautiful skyline or the helicopter. I apologize. And yeah, we just reviewed and that was pretty much it. They gave us this binder, and with this binder, they also gave us a NICU Pocket Pal. So it goes over, I mean, this was beautifully put together. So it's color coded, so it has a table of contents. It has important NICU info, patient care, like a weight conversion chart, assessment and documentation, patient care, like thermoregulation, skin care, pressure, injuries, medication, and fluids. So just basic, like, NICU things. That's, I mean, it's a quick reference. However, I feel like I learn better when I see clinical findings. Once I have a patient that's had this specific defect, it will be easier for me to remember what are the signs and symptoms, what is the treatment plan, and of course treatment plan is going to vary based on your patient, but to get a general understanding of the pathophysiology, like for me, I just have to have a patient with it. So again, this is just a lot of information overload. Each boot camp day has its own section in the binder. There's tabs of 5 days, and it goes more in depth of each system of the neonate. So for day 1, it was more like cardiovascular disorders. And then for day 2, I've already mentioned we did the NIS assessment for Finnegan. And then day 3, let's see what we're doing day 4, because I don't know. So we're doing vascular access day 4, which I feel is going to be great because this is kind of corresponding with what phase I'm in orientation. So I've reached phase 2 this week. So like I mentioned in a previous part of the video, more lines. So PICCs, IVs, and then work my way to UVCs and UACs, which are umbilical lines. And then I was also, this was supposed to be, I believe, printed in my folder or in my binder, but it was emailed to me after I noticed it was missing. So each week it'll explain what you're supposed to be competent in. So for phase 1, weeks 1 through 4, the skills that I was supposed to accomplish were assessment and documentation. For example, it says orientee will only perform assessments and vitals, no feeds, no medication administration, and the goal is by the end of week 2, orientee should be able to complete and document all assessments, I's and O's, vitals on a full patient assessment with minimal to no assistance. So this fellowship blueprint is what every nurse should get when you start in a new specialty or as a new grad nurse, because it'll break down, and it's very helpful for your preceptor to understand, okay, well, what is my orientee supposed to know in this point? Because we want to make sure that we are competent enough by the end of orientation to take care of a full assignment safely. You don't want to be drowning. And so if you are feeling at a point in your orientation where you're like, I have no idea what I'm supposed to be doing, then you need to voice that to your preceptor, and they'll either encourage you and say, no, you're doing fine, or you guys will come together and you'll reassess on what needs to be fixed and addressed. Yes. But luckily, I'm obsessed with my preceptor. She is amazing. She is so sweet, nice, and she's so smart. She explains things. I got my camera just so I can film some content that isn't just in the car. So today, I decided to get my preceptor a gift. I've had 2 preceptors in the past for work at my last hospital, and I wanted to give them a gift, but honestly, it was just not it for me. But I did have like a really good, strong relationship with one of them, so I would occasionally like buy her coffee or pay for her lunch without her knowing. So that's how I made up for that. This time, because I really do appreciate my preceptor's teaching style and just the way that she's so gentle with educating me. And ever since like I first met her, being a hijabi in a new hospital, in a new specialty, I was just very like insecure and very nervous. But like as soon as she saw me, she just gave me a great big smile, and then like we just started getting rapport. So yeah, I can't believe like how nice she is, and I think that she really does deserve a nice gift. So during the orientation period, I have been asking her questions about herself, where she moved from, how she got into the specialty, how she got into nursing, how she wants to progress with her career, if she wants to progress with her career. And I got to know her interests, her hobbies, because, you know, it's not just about nursing. So today, I'm gonna get her some gifts. It's also like my Sunday reset. Today is Saturday, but I have to get groceries because I have a new place, and so I have nothing to eat here. I have nothing to meal prep with, so hopefully I'll be able to show you what meal prepping looks like. And what else? I also have to finish my capstone project that's due in a couple days, and because I work 3/12s, I don't want to work on it on the very last minute, so I'm going to be finishing my project. I think you get the point. But yeah, those are the things that I'm going to be doing today. My brother had a game today, a baseball game, and I wanted to go this morning, but I stayed up really late last night, so I totally forgot to wake up early and forgot to go. And they live about an hour away, so there was no way I was making that in time. And I feel really bad. He has 2 games today. I just heard he won the first one, so that's very exciting. I missed a good game, I guess. And yeah, that's what the plans are. I am so excited for this gift. I looked online to see who had this specific Squishmallow, and I drove to GameStop, and the guy was so nice. He had like, there were like bins and boxes stacked of just Squishmallows, and I was like, online it says you have 1 Squishmallow in the store, and I didn't want to rudely like go through all these bins. So he helped me find Hedwig from Harry Potter. I know my preceptor is a Harry Potter fan. So, oh, and she really loves Squishmallows. So I figured I would just get her a Harry Potter Squishmallow. Not me making sure that it was Hedwig. Yeah, so this is the first part of her gift. I did tell her, because I know she loves reading, she has a Kindle. Oh my god, no, she doesn't have a Kindle. Yeah, is it? No, it's not a Kindle. Yeah, I think it's a Kindle. So she has a Kindle and she loves to read books. So I'm gonna get her a gift card from Amazon so that she can get herself a book. And I don't know if, I think the Amazon gift cards work for Kindle. So I think that'll be good. And then I'm also gonna get her some energy drinks. Yeah, energy drinks. And I think that's it. I also got my mom a gift. I just got her a candle from Yankee Candle because she's obsessed with them. And yeah, oh my god, I'm having such a great day. I call my grandmother. I feel so bad because I haven't been able to call her like as much. Just because of like my schedule, and I'm like working on my Spanish because sometimes like talking in Spanish, it's just like really exhausting, and grammatically like it doesn't come out well sometimes. So I feel really like embarrassed and shy to talk, but I feel like the more that I practice, the better I get. And what else? I'm also coming to see my family. Even though I missed like my brother's baseball games, I'm taking time to see my family. And even though I woke up like late this morning, it's still only not even 3 o'clock in the afternoon, and I got to like make a couple stops and stuff. I don't know if I'll be able to wash my car. Hopefully if I make it in time enough, I'll probably make it to the car wash before they close, because the one that I go to is in the city that I'm moving from, which is an hour away from my parents' house. So hopefully I'll still be able to get a car wash, and then I still have to work on my project, but I'm sure I'll have time in the evening. I also have to go grocery shopping and make dinner and probably meal prep for the next 3 days. So as soon as I got to my car, like from the mall getting this gift, I was like, oh my god, I'm just having such a great day. I'm so happy. I think like the day shift lifestyle is really like getting to me. I'm so happy. I feel like my mental health is at its peak right now, and it's kind of unfortunate because next week is my very last day shift week. And then next week I start night shift, but occasionally I'll have some like day shift classes. So on with the rest of my day. It is now Thursday, April 24th, and this week on Sunday, I had a 12-hour shift with my preceptor, and then on Monday the 21st, I had my last day shift with my preceptor. It was pretty intense. So we did ask for bubble CPAP. We asked for a bubble CPAP patient, which is higher acuity than what I've been doing. I was moving in and transitioning into that phase 2, which is, I've already gone over, more critical, you know, access and respiratory requirements on a neonate, which was very nice. But when we requested the mobile CPAP, we also got a patient who was on CPAP with a rate or BiPAP. So we did have 2 patients that was, you know, it was a pretty heavy assignment, but I think we did an amazing job. My preceptor complimented me on everything. Like, I was doing such a great job, which it was a confidence booster. We did get out a little bit later than I would have liked, but given that, you know, the 2 patients together was pretty heavy, we did finish charting just a little bit later than what we were used to. working together. And then finally in the end, when we were saying our goodbyes, I did give my gift to her and she was absolutely grateful. So I'm very grateful to have had her as my very first preceptor in, you know, my NICU specialty. We also had boot camp number 4 on this past Tuesday, which was amazing because it matched up with what I was doing the previous shift. So besides vascular access and lab draws, we had a presentation about like PICS and stuff like that. We also did medication calculation and dilution. So this topic was introduced to us in the very first week of like our clinical NICU orientation, and I was completely lost. I did have a video strictly on dosage calculations when I had my previous videos, because I just loved it so much, and I noticed that other students in my class were not understanding the concept and not getting, you know, their problems set up. Like they weren't understanding the concept of dimensional analysis, and so I created a video to help other students understand dimensional analysis. With medication calculation and dilution, I understand the concept with these babies are so small receiving these medications, and for example morphine, they're only getting like a small amount of volume of this morphine. So what we have to do is we have to dilute it with normal saline before we program it into the pump, and so based on how much we're diluting it is how much we're actually administering. So the dosage is technically the same, but the amount of volume that they're getting is different. And so the concept I understand, but like the math portion and trying to plug everything in, I'm kind of just a little bit slower on it. And so I've been introduced to it multiple times. I've practiced with my preceptor, and we've had a couple lectures on it. We've had it more in depth on boot camp number 4, but unfortunately after the couple times in the practices that we've had, it just still wasn't sticking. But honestly, I didn't raise my hand in class. I didn't say I wasn't understanding it, because at this point I feel like it's something that I just have to genuinely practice on my own. And because I fell in love with this specialty, I have no problem going back and relearning everything that was provided for me. So medication calculation and dilution, I have to practice that more. And then of course we went into non-invasive ventilation. So we did CPAP and we did NIPPV. So we did a little bit of a lecture, and then we were able to go to the sim lab and see these equipments firsthand. Luckily I was able, it was kind of like review for me because I've had a baby on Vapotherm, and which is high flow nasal cannula, and then I've also had a CPAP and then a CPAP with a rate. So that was amazing to just have a little bit extra time with that equipment. And then yeah, so we just did skills, and then today, like I said, we did neonatal resuscitation. So for neonates, they don't really meet that criteria of pediatric advanced life support. So we have what's called neonatal resuscitation. We did online modules individually, and then we like practice in the sim lab, which, like I've mentioned in a previous clip, we have an amazing sim lab. So it was really nice to get that hands-on experience, because in the event that I do have to do it on my patient, or if I have to do it on another patient in on the unit, it will kind of be a little bit more familiar. So I definitely need to practice on medication administration and dilution, because the numbers are so small compared to what it is that I'm actually used to. So luckily I am able to identify what my weaknesses are and what it is that I need to review and touch up on. I think you guys will be able to follow me on my journey on how I studied to be an amazing NICU nurse, which is very exciting. So thank you guys so much for watching.